Hello, listeners. I am super excited today. I feel like every time I do a podcast, I'm super excited, but I'm really excited today because I am joined by Dr. Jenna Blum. Hello, Jenna.
Hi.
How are you?
I'm good. How are you?
I'm not sure whether to call you Jenna, Dr. Jenna. What do I call you?
I don't know. I don't know if I should call you Dr. E.
So, for our listeners, this is Dr. Jenna Blum. This is my daughter, Jenna. She finished her doctoral program, is now working full time at the Smart Center, although she's been working with the Smart Center since you are just a little tot. Do you remember going to conferences with me, Jenna?
I do. I feel like I've been working at the Smart Center since I was basically out of the womb, honestly. I feel like I remember going to conferences and I would always want to sneak up to the front while you were talking. So I was so excited to finally get to this day. Yeah.
Yeah, I used to go to conferences. You'd hand out the books, you'd hand out the registration packets, and hey, I've got books over here. You were always involved from the time that we started. So it's a full circle moment for me. And the fact that you went into psychology and you've been working at the Smart Center since we did I remember the Selective Mutism boot camp.
Yeah.
Do you remember that at Willow Grove Day Camp?
Yeah, we used to do boot camp where we would have families come in for a weekend, and I think it was just more like a retreat. They would just get to know other families that had SM, and it was a really, really fun time.
Yeah, and then we used to do like different treatment there, but it wasn't anything like what we have now with Communicamp in terms of an intensive group program. It was more of, like you said, a family fun weekend for people to meet and greet.
Right, yeah.
But I am really excited to have you here. I wanted you to kind of describe, again, I'm like looking at you because you're my little girl, but you're also a doctor now and you have so much credibility. You've been in this field working with families for so many years and working at Communicamp, the director of Communicamp counselors. You've led Communicamp groups over the years where you had your own campers. And you've been just so involved in every single aspect of what we do. You speak at Communicamp now. I mean, honestly, you can take over the entire center. I'm ready to go to Hawaii, listeners. I am ready to retire. No, I'm kidding. Not retiring anytime soon.
Don't tell your listeners that. They'll be really anxious. Just staying, everyone.
I am not retiring. I wouldn't know what to do with myself.
Yeah, she's actually becoming in even more now that I'm here. So.
Yeah, probably.
Our offices are right next to each other.
So cute, and I'm even decorating her office. She has a budget for this.
Yeah. You are doing that.
So anyway, Jenna, I just thought maybe you can describe your interest and passion and what you've been trained in terms of what you have to offer us at the Smart Center.
Yeah. Well, like you said, I feel like I was interested in psychology since I was a little kid. I feel like it's probably because I watched you, honestly, like looking at just everything that you've done. But, I graduated from the Chestnut Hill College PsyD program. And basically there I concentrated in family systems. So I've always been really interested in parenting. I know that that's something that we're probably going to be doing in a little bit. It's a parenting podcast. So it's always been a very big interest of mine is including family systems like within my work. So I would say like my biggest interest is working with, kids, teens, but also really including a lot of their families and working with people from all over. I'm really interested in SM and, obviously I've been watching you throughout my whole life, but I definitely am excited to work with a lot of different, families that have a lot of, an array of kind of things that are going on. So,
yeah. And I think that one of the most wonderful things we've been doing treatment at the Smart Center for so many years, and we've been doing testing at the Smart Center for so many years, testing for full batteries, psychoeducational batteries. We've been doing autism testing, ADHD testing, concentrating a lot on our population. But one of the most beautiful things is that we have started in the last few years and really kind of revved it up recently because of the major demand, especially post-COVID, in counseling and assessments. So we have counseling and assessments, CNA, at the Smart Center. So you are going to basically be running that section of the center, since that's your strong interest is not just selective mutism, although you're amazing at it. Your families can certainly say that, and your patients that are now have their voice can express that, but also the fact that you have such a background. Another area that I just wanted to emphasize is your interest in assessments. That's something really strong. You've gotten extra certifications, and that's been a real strong interest. So you'll be adding that to the Smart Center too. So once again, I am so thankful because these are areas that we've been wanting to do and meet the requests and demands of our families.
Yeah.
And you're going to be able to take that to the next level.
Yeah, no, I'm definitely excited. I feel like, especially since post-COVID, I would say not only is it a big interest of mine, but I feel like there's a lot of misdiagnoses out there. So I'm definitely excited to emphasize more assessment at the Smart Center, because I feel like there's a lot of parents that come in. One, a lot of people don't test a lot of nonverbal kids. So I think that's something that we've always done. But also, just like you mentioned, additional testing I think is really helpful because, as there's a lot of families that come in that their child is SM, but there's a lot of comorbidities. I know you talk about that a lot. So I think there's definitely a need for additional testing. So I'm excited to be a big part of that.
Yeah, no, I am too. So we're going to definitely dive into that as well. What are you the most excited about joining the Smart Center full time, other than taking over the entire process at the Smart Center?
Honestly, I think just continuing to meet with families from really all over the world. I would say that's like definitely one of the more unique things about the Smart Center is, having families from Switzerland or just all over, really. I've met with a lot of different families. But honestly, just the community, I would say. I think that's something that we get a lot of feedback from with our communicant families and just families that we work with, is that we really do provide a lot of comfort. And I think that comes with the team that we have at the Smart Center. So I'm actually just really excited to come into work every day and just be around people that I know kind of are, you're literally my family, but I think, the Smart Center also has formed a really nice kind of family unit too. So.
Yeah, it's taken a long time to find the team that we have, and we've got an amazing team, and I'm excited. I do feel that you are starting to kind of take over a little sooner than I thought you would.
What does that mean?
It means like you've already come in and have a list of things we need to change.
There are some things that I think that we need to change. We need a bigger fridge. But
Yeah, I mean, the first thing she said on day one is we need a new fridge. I'm like, seriously?
I mean, it's nice to have a big fridge. I mean, if you're there all day with lunch, I mean, it's really important.
I know. So she's getting a fridge. She started ordering new furniture for her room.
Well, the furniture is important.
It is.
It is important to have a really nice couch for your clients. So I got a really comfortable couch. Just putting that out there.
I come in. I'm wondering where Dr. Jenna is. I'm wondering where Laura is, our office manager, and then they're like, "Well, they're in a meeting," and I'm like, "We need a meeting. Why am I not included in this meeting?"
I think it's important to have individual meetings.
I know, but don't you think, as the director of the center, I should have known about this meeting?
I think we could definitely talk about that moving forward.
Yeah, was this like some secret meeting?
No, there was nothing secret in there. I think it's just, we were just catching up.
I'm really excited. Obviously, there's no more joy than knowing that you've chosen this passion in psychology and you have such an interest and strength in selective mutism and treating these kids and these teens and these adults. We have so many adults now. It's unbelievable.
Yeah, we do. I would say since post-COVID, I think there's so many people that just have so many difficulties in general with socialization. So I think that would be a really interesting, I know you were saying this actually, like an interesting research project for the future, but like pre and post COVID of the type of, symptoms and the type of individuals that are coming into the center, because I think we're definitely seeing a bigger kind of like adult population coming in.
Yeah, and I think things have changed since COVID. I mean, pre-COVID, selective mutism absolutely existed, but knowing selective mutism is a social communication anxiety, I definitely have seen over the years, even before COVID, kind of a rise in social communication anxiety disorders. And my theory is technology. Like, as much as technology is there to help us, and it does help us, and it's incredible. I mean, look, we're able to do this podcast, video is able to be done. We're able to meet with families through telehealth, Zoom meetings, webinar. I mean, it's amazing. We're able to order our food through Instacart and our supplies through Amazon. I mean, technology is incredible. However, it has affected social communication, skill building, and confidence.
Mm-hmm.
And I definitely think we need to kind of do a podcast on social communication and how technology affects that.
Yeah, I mean, I think it's hard because I think a lot of teenagers, that's like their way to connect. And I think that's where sometimes there's a disconnect with parents, because I know that I've had parents say to me before, like, my child won't leave the room, but they're on their gaming for, like 3-4 hours and they need to go to bed before school. But then when, I explore that with the teen, they're on a gaming network, but they're also engaging with like 3 peers. And that's like their way of engagement. And it might take them a little bit before they get comfortable in person with someone. So I think it's more about like navigating the middle ground of that, because I think there's so many benefits, but it's more about like, maybe like you said, like what are social communication opportunities within the virtual world? And I think navigating that.
And this is definitely related to the technology, but also COVID, that get-togethers at people's homes, which is such an important way to build connections. And with little kids as parents, we can set it up. But I'm even seeing, and you're even seeing, how get-togethers at home are much less frequent now post-COVID,
Yeah.
and how the effect of technology plays a role in that. And so that opportunity to build social communication connections, to practice skills, to build the friendships, that whole avenue is really much less than it was years ago. And what's also happening is as kids age, parents are very frustrated. My child won't have a get together. She refuses it. Even if she's, has a few connections at school, or even if they don't, it's such a wonderful opportunity. And so what parents don't realize is because of technology, they don't feel the need to get together as much. They may be texting if they're texting.
Right.
And so we're seeing a lot less of those avenues to build those skills in all ages.
Yeah.
Yeah,
no, I mean, I think even just without having selective mutism, I think there's so many people that are just disengaging. I mean, I met with a 4-year-old and her family last week, and the family was saying, like, I don't know what to do. I've been trying to have play dates. I've been reaching out to every kid in my class or the kids' parents, and no one's really responding. So I think even just beyond SM, you always say, like, our kids are so much more prepared than anyone else because we teach them so many of these skills. But I think there's a lot of people outside of the SM world that could really utilize these skills too, because a lot of people were learning that we're just more so disengaging.
No, it's definitely absolutely true. And this is where relying on schools is so important, because through schools, through clubs, activities, pairing and grouping kids with the same kids over and over, and trying to foster these kids' interests and strengths to connect. I always say it's through the activities of interest that the kids are going to find their peeps. And having connections, social connections, is such an important part of life and navigating the social world, let alone communication. So
Exactly.
we're definitely seeing so many needs, like you said, beyond the SM world, just social communication challenges in general, and confidence. I mean, and what happens when you're highly anxious? Your affect changes.
Right.
You get that flat affect, you get like, I'm not interested affect, and that's projected onto others.
Right. Yeah. I mean, I can imagine it makes people feel like they don't want to engage with you if you're kind of showing more of that flat affect. So,
yeah. So I'm excited. I think we can do tons of podcasts together, just talk about topics. We know each other pretty well, I think.
I think so too. I think we could even just set up a podcast at home and just whenever we're, just hanging out.
We could just put on the mics, push record, and we're good to go.
Yeah, I think so. Yeah. People will like that.
Yeah, I do too. Any topic would do.
Yeah.
What are some topics you would like to talk about?
Oh, it's a good question. Like I mentioned earlier, I'm very interested in parenting. So I know that's something that we talked about is having a podcast about maybe different parenting styles and, different things that we're seeing in treatment. I know parents ask me all the time, what can I do? How can I intervene? What are helpful things I can do? What is harmful for my kid? So definitely parenting, but also just, I think just navigating, I guess, just like the world now. Like, I think just in general, like I said, this goes beyond just SM, and that's why I'm so excited about counseling and assessment, because I think there's so many families.
CNA.
Yeah,
CNA.
CNA. CNA. It's true though. I think there's such a need for it, because I think that so many of my families that I work with that have SM, they might have a brother with ADHD and he's sitting there like, how can I get some help? And so I think just navigating the different family systems. So I'm just excited about it all. Honestly, if there's any topics you have, I can just hop right in.
I know you can. When you mentioned parenting, I'm excited to review parenting styles and talk about the effect of parenting styles on treatment. How does your child respond based on your style of parenting?
Yeah.
And if you have two parents parenting, you may have two different styles, which can not necessarily listen to me, may not necessarily impact the child positively.
Yeah.
So being able to educate parents on skills is really important, and to be able to alter their parenting styles if they have a parenting style that is not, beneficial in terms of treatment. Like we see the different styles and how it affects treatment. And I have seen over the years, and again, amazing research study, but definitely the different styles: permissive, uninvolved, authoritarian, authoritative. We're going to go into those in depth. And obviously authoritative parenting is the most ideal to parent all children, not just children with SM. And what are the specific characteristics of that type of parenting that does benefit our children, and how you can utilize various skills within that parenting style. I think that's going to be incredible.
Yeah, no, definitely. I mean, I think, like you said, I think sometimes parents, it's hard to, let's say, like alter their parenting style, but I think just having an awareness of maybe how how those differences are impacting and how to kind of talk about that. So I think a big part of even what we do is also navigating that sometimes instead of just working with the kid, we might just have a parenting session, right? And kind of talk about that and talk about those differences and honestly how that could even be impacting them as a couple, I think is really important too. So yeah, I definitely am excited about, the parenting podcast that we're going to be putting out.
So we're at Communicamp right now.
We are a Communicamp, so that's why there's little kids running around. I don't know if you hear that, but
yeah, but they're not just running around. What are they doing?
They're communicating.
Yeah, they're verbalizing. They're laughing. They're having fun. The counselors are trying to kind of keep them away from our door. So
yeah.
But we are at Communicamp, and I'm excited. And one of the things that stands out about Communicamp that was so important to me when we formed this was parenting.
Yeah.
Parents are absolutely critical for success, and we pride ourselves on all-day parent education and support. And I think that everyone should realize the importance that you can't rely on taking your child to the therapist or sending your child to camp and assuming the child's going to be the one to make all the progress on their own. It takes parent, intervention. I always say, don't wait, facilitate. And we saw in our studies and we see across the board how implementation is so critical for success. So such a big part of what we do in our individual programs as well as at Communicamp is train parents. And we troubleshoot that at camp and question answer sessions and things like that. So I'm excited for that. I'm excited for your involvement. Another area that I could really see you diving into is you have such a strong interest in testing and assessments. And I think having podcasts and opportunities to learn about testing and to learn about what we see in this population with selective mutism in terms of some learning challenges or different difficulties that we see and when to consider testing for children with selective mutism or any child in general.
Yeah.
And I know you have an extra certification in autism testing, so you'll be able to add a lot of that to what we talk about. And so I'm, again, I'm excited. I think the mental health world in general, depression, anxiety, all the challenges that you're seeing. I mean, are you seeing more depression in counseling right now?
Yeah, I mean, I would say that I don't have like a actual percentage right now, but I definitely would say that one of my biggest interests is working with teenagers. And I will say that unfortunately, I feel like that population is really getting hit with a lot of depression. I think that, like you mentioned, technology could be impacting that. But I also just think the amount of disengagement and, with teenagers, one of the most important pieces of being a teen is socializing and being with same age peers. And that's a really crucial time to kind of branch out from your family and kind of gain some of those same age peers. And a lot of teenagers aren't, unfortunately, they're not really doing that. So I think that's something that I'm definitely seeing. And I know you keep mentioning COVID, and that's definitely something I'm seeing is think about like a 14-year-old, right? Like they were 10 years old when COVID hit. So it was 4 years ago. So all the important middle school tools and kind of strategies that you're supposed to be learning, they didn't really learn a lot of that stuff. And now they're supposed to navigate a high school world where they didn't even have a lot of the skills from middle school. So I think there's so many pieces of why depression is really increasing, but I definitely think that's something that people should be aware of and honestly normalize, because I think a lot of people are probably feeling it more than people expect.
Yeah, I think there's so many things intertwined. It's not just one thing, but I definitely feel like with social media, definitely talking about how social media impacts mental health. I mean, there's a lot of research now out there with increasing anxiety, depression, bullying. There's just a lot happening. I mean, social media can be amazing. I mean, I use it.
Yeah.
Right? We use it for so many reasons and there's so many benefits, but there's also some risks and harm involved.
Right. Well, and I think that's why, I was saying earlier, I think it's more about how we utilize social media. So it's like we have the outlet now to use social media, and we should be. It's more, what are we doing on social media that we could be, building more social communication opportunities, and also thinking about what are the harmful aspects of social media. So like you said, the bullying piece, like what are certain, avenues that people are maybe taking advantage of or that they're utilizing more that's maybe leading into more of that like cyberbullying.
Yeah, and also parenting controls of social media. I mean,
yeah,
kids are on their devices 100 hours a day, and then their parents are wondering why the child doesn't have skills.
Right. No, that's definitely a good point. I definitely have a fair share of clients that actually have, like you said, those parenting controls. So, after like 9 p.m., their social media goes off. And that's definitely been something that I've worked towards with certain families.
Yeah, really restricting them and stuff. I would say another area that I really want to talk about is boosting independence in kids as they get older. We see in this population with selective mutism, but the kind of learned helplessness and dependency that kids have. And some of that is a result of parents wanting to help and rescue and protect. And although as a parent, I get it, right? I'm a mom of four and I get it. You don't want your child to feel upset or, that you want to protect them in every way. And especially if you have a child that isn't speaking, you don't want them uncomfortable. So you speak for them, you do for them, you rescue for them, you rescue them. And what ends up happening is the child, as they age, they're not navigating their life. They're very dependent. They don't pay attention. And I have a term called like the navigator, like the passenger in the car. Kids are passengers in the car. They get to be 15, 16, 18, 25. They're passengers. If everyone is doing for them, speaking for them, they're not paying attention to the social communication nuances. Because they're the passenger in the car. Their friends are talking for them, their siblings, their parents. They're interacting with others. They're starting to not go out as much. They're not interacting and they're not learning the skills. It's not that they don't have the ability. There's a difference between skills and comfort and, confidence. So there's so many of the kids we work with that just don't have skills, but they have the ability.
Right.
And so as we, build the connections, the comfort, we teach the skills, all of a sudden the child is doing it. But it's, again, bringing back parenting. It's training parents on how to navigate that, how to step back, how to put their child on the front line, how to help the child become more independent through decision making, managing their schedule. There's so many different avenues and really kind of navigating that with parents because they don't realize it. They want to help so badly, but they don't realize how they're reinforcing some of these behaviors and the child is so dependent. Often I see when we do so much telehealth at the center, like you said, we see families from all over the world. And I'd say the majority aren't from Philadelphia, right? They're from outside of Philadelphia. So when we're doing telehealth, when a question is asked, you see the child, no matter what age they are, 8 years old, 15 years old. As soon as a question is asked, the child looks to the parent to answer. It's almost like an automatic reflex. And the child just turns to the parent. Even if the child knows the answer, even non-verbally to communicate, they're so used to turning to their parent because their parent is the one that says, say this, do that, or answers for them. So anyway, it's endless. I mean, you and I could talk forever.
Yeah, I definitely agree with that.
I don't think that we ever have a lapsing conversation, even when we're just hanging out.
Yeah, that is true. I definitely think we have a hard time turning off our work brains too, because we do take it home a lot from work. So
yeah. I think we're the most similar, probably, you and I. Like we can understand each other. We chat a lot, me and you. We're the talkers in the family.
I would say so.
Yeah.
I definitely was. I would definitely agree with that one.
So at work, am I supposed to call you like Jenna, sweetheart, honey, or do I have to call you Dr. Jenna because it's at work now?
Even at home, if you want to call me Dr. Jen, I really wouldn't mind that.
I actually changed your name in my phone to Dr. Jenna.
I appreciate that.
Yeah. So I mean, it's going to get a little awkward in front of your siblings and your aunts and uncles if I just continue to call you Dr. Jenna. But if I'm going to call you Dr. Jenna, I really do ask that you call me Dr. E.
I do call you Dr. E.
Yeah. At home, you call me?
I do. I honestly, I do. No. You can call me Jenna.
Behind the scenes, you're Jenna. In front of people, you're Dr. Jenna?
Yeah, I think so. I mean, I think it's funny because I know you always say this. Like, sometimes there's clients that we'll meet with at various times or even at Communicant. And even if I don't say, or you don't introduce me as your daughter, I think sometimes people kind of catch on because we're very similar. So
yeah,
I think even if you say Jenna, I think people fast, kind of will look around and be like, they have a similar personality.
Yeah.
I think something's going on that I think there's something deeper than just.
Yeah. We look a little like. I mean, you're a younger kind of Dr. E 2.0, Jenna. You're like the next generation.
Yeah, I think so.
Yeah.
Yeah.
So listeners, this was our very first podcast together, just having a conversation, and it was pretty much ad lib. We didn't plan any of this, but we chatted for, I don't know, almost 30 minutes, just chatting. And so I'm excited for all the other opportunities to talk with you. I'm excited for our Communicamp podcast. Right now we're at Communicamp and Jennifer Brittingham is running the parent panel upstairs where we have past patients, parents, teens that struggled with selective mutism that just came to camp last year and are up there on a panel. So that's exciting. And then I'm going to be doing a podcast with you in a little bit with some of the parents from Communicamp. to kind of answer their questions regarding summer and traveling and socialization, and we'll see where that goes. But again, I'm just super excited for the future. I'm super excited to share a wall between us in the office where I know where you are, you know where I'm at. We can have lunch together. We can kind of like meet in the middle. I think it'll be great.
Yeah, no, and I appreciate you bringing me on. I'm excited to continue connecting.
I mean, did I have a choice?
I think that you've really been asking me for months now to join the podcast.
For months? Well, no, I'm talking joining the Smart Center.
Oh, the Smart Center. I do think actually, you know, there were times where I don't know if I had a choice, but I do think you kind of did take a step back and I chose to kind of dive in. So yeah. I do think that I had a choice.
I didn't want to push you too much.
Yeah. I really do feel like this is the perfect place for me to grow, but I also think this is a kind of like, you know, I think this is where I'm meant to be. So I'm excited to continue helping families from really all over. And like you mentioned, I'm really excited to not only work with SM families, but really branch out and kind of broaden this aspect.
C and N.
Yeah.
C and N. C and N.
I am excited.
I know you are.
Yeah.
Thank you. Bye, listeners.
Thank you so much.